Cannabis helps AIDS patients. Medical marijuana. AIDS is defined stands for Acquired Immune Deficiency Syndrome. Acquired immune deficiency syndrome is a combination of symptoms that appear due to a failure of the immune system in the wake of HIV infection. Patients suffering from opportunistic infections and tumors, both life-threatening. It is estimated that more than 25 million people have died from the disease in the last 30 years. Since the mid-90s there is medication that prevents the onset of the disease and allows carriers to live with the HIV virus in nearly the same as those who do not carry the virus. So now carriers of HIV status is considered chronic and terminal illness. HIV is the virus that harms the many functions that issues of blood clotting problems, infections that do not heal, withdrawal of fat cells in the body tissues and other symptoms that leave the low life quality patient care to prevent withdrawal without the patient's immune system and handling the rest of the symptoms. There is no treatment still leads the elimination of the virus does not has the experimental stage so most treatments currently focusing on in trying to prevent and avoid replication of the virus in the body cells and prevent him from moving from the incubation stage of active disease. Cannabis helps AIDS patients. Recent years reached more evidence of individuals and research groups than examined the relief lifestyle AIDS patients. Cannabis smokers reported it to their doctors. Relief for AIDS using HIV is well known in the medical service in countries where marijuana use range such as California, the U.S. state many times during the 80s accused of the virus because it blooms hunter-y lifestyle of hippies especially the San Francisco area. But this argument does not correct but is indeed true that among hippies in California, there was a marijuana smoking and these whom were HIV positive or ill, and especially their reports triggered many studies in the field. Ronald Ellis, for example, a doctor from San Diego in 2008 published a study entitled Smoked Medicinal Cannabis for Neuropathic Pain in HIV, a randomized, crossover clinical trial. The study found that patients with the virus, Dr. Ellis reported a sharp decline of 45% in pain with cannabis use than the control group. His research was published in the journal Neuropsychopharmacology that year and is playing the findings on the efficacy of cannabis treatment of pain arising neuropsychology www.jewishmeditation.org.il, i.e., pain arising from a lack of ability to cope nervous system and regulate the pain suffered by that person. www.researchgate.net web link Smoked medicinal cannabis for neuropathic pain in HIV a randomized crossover clinical trial. Cannabis helps AIDS patients. In 2005 there was an article done by medical staff at the hospital Chelsea Westminster in London found that cannabis helps patients with HIV than any other drug known to medical relief for the symptoms of HIV, especially anorexia that afflicts patients. The medical staff concluded in an article reviewing the experiment that cannabis is the best medicine you can give AIDS relief of symptoms, which brings the virus, such as nausea, loss of balance, muscle aches, pain and neurological derived from nerve damage, anxiety, and tingling skin due to the collapse of the nervous system peripheral. www.japesomjournal.com web link 392405000631/abstract. Cannabis helps AIDS patients. Depression and loss of appetite are common symptoms in carriers and AIDS patients, as Dr. Margaret Haney Columbia University published her article Dronabinol and Marijuana in HIV-positive marijuana smokers, caloric intake, mood, and sleep. Patients who received medical cannabis mentioned a larger appetite or appearance because that did not exist before the consumption of cannabis and body weight increased continuously during the experiment. Dr. Margaret The report notes the return of vitality and mood among patients who tried to overcome the fall in cannabis. The article received wide media coverage and often excellent websites about the issue of decertification about this study was conducted in August 2007 while conforming to the article published on the internet at www.safeaccess.ca web link. Cannabis helps AIDS patients can be found in many studies conducted in the last 10 years mainly in the US and especially California. Connect between marijuana as a medicine to ease the pain grow symptoms of HIV, but there are also studies showing that the consumption of marijuana is also beneficial for slowing the rate of virus evolution, according research published in 2012 by researcher Dr. Xavier Ramirez at Philadelphia. Find groundbreaking research since joined the tour to a number of researchers and doctors. Study of Dr. Ramirez suggests that using marijuana slows the rate of development and reproduction virus in the body of the patient/carrier. The AIDS virus attacks the mashed vaccine of the person and makes her mark the body of the person as an end, and the immune system attacks itself of that person. The same person is sick with the virus. The virus spreads to cells in the body. Marijuana patients with the virus in recent years showing a slowdown in the rate of spread of the virus. Cannabis helps AIDS patients. On March 20, 2012 lays out an article by a medical team at Mount Sinai Hospital in New York on how the active ingredients of cannabis to help slow the rate of spread of the virus and the relief of symptoms of the virus. The article explains that there are receptors in our brains named CR and comes in several varieties. CR1 is a receptor in contact with the active ingredient THC, creates the feeling hey that comes with smoking and digestion cannabis products. CR2 is a similar receptor that reacts with THC but is connected to activate and strengthen the immune system and is responsible for running operations in the digestive system and the nervous system, the rest of the nervous system except the brain and spinal cord. Dr. Cristina Maria Constantino was director of research, reduced it after a while, to investigate how THC affects the receptor. CR4 responds to operating a chain of CR2 and can be driven in a lab. Also measured the progression and spread of the AIDS virus in living tissue. CR4 was known in the medical system while aiding slow the spread of the virus, and therefore chose Dr. focus on research and has helped to understand and demonstrate the contribution of cannabis in slowing the spread. In conclusion, we showed examinee medical use of cannabis for the relief of symptoms suffered by patients with HIV, is considered successful use and recommended by the medical community, and even more, the researchers were able to link between smoking cannabis to combat the spread of the virus in the body to slowing the spread of the virus.